All right, guys, today's gonna be a fun one. We're gonna play true or false, which does sound boring, but I promise it's gonna be fun. Over on Instagram, you guys sent me all of your myths, ponderances, things you've always wondered deep down about healthcare, being an NP, being a nurse, all of that good stuff. And today we're gonna say, is it true or is it false? Because I think healthcare is one of those things that gets kind of hyped up and all sorts of rumors start flying all over the place. So today we're gonna lay to rest a couple of those and hopefully learn a few things along the way. If you guys are brand new here, I'm Liz. I'm a family nurse practitioner and I was a bedside nurse for years before that. So hopefully I've learned a thing or two along the way in regards to healthcare. I guess we'll find out today. Also, quick sidebar. All the true and falses here are my true and falses, not necessarily everyone's true and falses, so yours might be different, but this is what I've experienced. It's gonna vary across the board, so don't, get all up and bothered if this is not what you have experienced. All right, we're jumping right into it. Nursing school is the hardest thing in the world. False, my friends, false. Nurse practitioner school is the hardest thing in the world. Just kidding, but really. Guys, nursing school is very challenging, yes, but it's not the hardest thing in the world. As long as you dedicate yourself to it, give it the time that it needs, and really commit to it, you'll be fine. Nurse practitioners are out to steal physician jobs. Nurse practitioners are not out to steal physician jobs. I think maybe some physicians think that they are. Kind of gets a little sticky when it's like the roles are very similar, but they are definitely different. So I think they play well together. Let's all just play nicely together. Nursing school and medical school are on the same track. So this is kind of playing into nursing school, like eventually leads to medical school, or people ask, are you trying to become a doctor? No. So this is kind of like if you're thinking about being on two different roads that look at each other and sometimes they can mingle, but they are really two different roads, okay? Nursing school, the medical school track. Obviously you can go to nursing school and then go to medical school. So there's, little intersections where you can enter the freeway, but they are different. They both serve wonderful purposes. They're both absolutely necessary in healthcare, but one does not lead to the other. You will find your best friends in nursing school. Ding, ding, ding. This is fairly true. I have some wonderful friends that I've met in nursing school. You really bond over the chaos. I know my support group now is my girls I went to NP school with. And I think nursing in general, you're gonna make some really great friends in nursing school, and then your nurse friends that you make on the unit, those are also gonna be great people. The whole stress and chaos of it really brings you together. So I hope you have some people you really like. Now these are getting fun. Relationships and hookup scandals happen in the hospital, just like Grey's Anatomy. Ding, ding, ding. So this is true. And this is something, at least in my experience, and this is something that's definitely more prevalent in the physician, provider, resident aspect rather than the nursing world. And I think it's just because, you're there all the time, you're putting in these crazy hours. But yes, this does happen. I have heard many stories. Moving right in the vein of that, McDreamy is way hotter than McSteamy. Friends, personally, this is a big fat false. McSteamy was always way hotter than McDreamy, but that all went completely out of the window as soon as Jackson showed up. Also, if you have no idea what this is Grey's Anatomy, which I actually stopped watching when, a couple seasons ago because I just couldn't, my heart couldn't take it. But there's where I lay on that one. Jesse Williams is a nice person to look at. The next one is probably one of my biggest pet peeves when watching medical shows. Defibrillating a patient with a flat line will resuscitate them. If you have a flat line, that means there is no electrical activity going on in your heart. Therefore, you can't jumpstart it. So if you think about it like this, a defibrillator is kind of like the steering wheel on your car. If you have totally lost control of your vehicle, AKA your heart is like, and doing all sorts of crazy things, your steering wheel is going to be going all different directions, but your car is still moving. So this is like your heart. If your heart is having a moment and it's just spazzing out, the electrical activity is gonna look wild. It's gonna be doing its crazy wiggly thing, but there is still electrical activity. Your car is still in motion, and the steering wheel is like the defibrillator where it takes control of the situation and says, friend, you are not operating properly. This is how we do, with a quick little boom, shock to kind of whip it back into shape. You shock the heart, it remembers, oh my gosh, yes, we have to steer correctly, and hopefully it'll start beating correctly. But if your car is not in motion, if there is no electrical activity going on, shocking it and using the steering wheel is useless, okay? So you cannot shock a flat line, nothing will happen. That's why you do CPR in hopes that you can do a little bit of pushing on that car to get it rolling just enough to use your steering wheel. Got me? All your medical shows will now be ruined. You're welcome. Okay, next. Nurses think about you when they go home. Ding, ding, ding. At least in my case, I've had a lot of patients, where I go home and they're still on my mind. You know, I'm like, ooh, I wonder if they're doing this. I wonder if they're nauseous. As a nurse practitioner, I've had the same thing. Like, I wonder how they're doing today. But I think on an inpatient basis, it was a lot stronger, and I thought a lot more about them because I was with a couple of people each day for like a lot of hours, and so I think it's natural to go home and think about them. Getting a job in a specialty area such as psych, the NICU, pediatrics, labor and delivery, straight out of nursing school will cause you to lose skills you learned. Guys, this probably doesn't sound great, but you don't have a lot of skills graduating from nursing school. You think you do, but most of the skills for your job you're going to learn are going to be on the job. So you might as well, if you want to go into one of those, go into one of them. As healthcare has progressed, units become more and more specific, so really most areas are a specialty unit. Whenever you move to a new one, you're gonna have to gain all those new skills and get the special training in that area anyway, so you might as well just go for it. Do it. Nurses and healthcare providers talk about you to their families. Ding, ding, ding. Obviously, no names are involved, and you try to keep it as HIPAA as possible, but I mean, no lie, like sometimes you do. You know, obviously, like I said, no names, but you do talk to you about your patients with your family members. It happens. And usually the grosser, the more you talk about it at dinner for some reason, because that seems to make all your family members really happy. When you're talking about the wound debridement and the tunneling sacral ulcer that you were, you know, debriding earlier. That's really goes really well with chicken Alfredo. Family nurse practitioners can work in the emergency department. Ding, ding, ding. So I'm gonna give this one a slightly less enthusiastic true, because they can, but should they? Meh. That's kind of the emergency department is kind of like the in between. I personally think it would be better suited for an acute care nurse practitioner. Family obviously can. You can also become certified as an emergency department nurse practitioner, which I think would be a great idea. But yes, technically they can. Although family nurse practitioners, if you're going by what your education is, it's really primary care, and the emergency department is not considered primary care. Physicians start IVs, take blood pressures, and transport patients. So I know this is depicted a lot on television shows where like the physicians are doing a lot. I mean, they do know how to do those things. I don't think I've ever had a physician take a blood pressure. I have not had one start like a peripheral IV, but I don't know how to do that either. I have had a surgeon transport my patient once, and that was when I told them, you really need to come look at this kid, and they did, and they said, oh my gosh, we're going to the OR, and they took them in that moment, and that's the only time. Other than that, not really. I mean, that's not their job. You can get a blood clot from a bubble in your IV. And I'm talking bubble. It takes like a whole line of tubing, so 15 to 30 mLs of air to actually cause some really serious issues on your inside, so those little bubbles are totally harmless and fine. Obviously, NICU baby, anything like really small, that might be a different story, but for the most part, it's okay. If you are young, you are healthy. This is sad. This is something I think we see in society a lot, is we assume young people are healthy. We assume if you don't see anything wrong with someone on the outside that they are healthy. Moral of this story is just treat everyone with respect. Try to be as understanding and open-minded as possible when talking to people. Really hear them. Just because they are young does not mean they don't have chronic illnesses. It's our natural assumption a lot, I think, to assume you're young, you're healthy, but to those people, they would give anything to be young and healthy, so it can be painful for when they're not young and healthy. Being an NP is more rewarding than being a nurse. Personally, false. At this point, I think maybe one day I'll change my mind, but as a nurse, I could see the immediate results of my actions. You know, you are uncomfortable, I can help you become comfortable. You're actively declining, I can do the interventions or get the right people here to help improve you. And that gave me a lot more personal satisfaction. Right now I'm playing the long game. And I think over time as a nurse practitioner, as I see people over the years, that will give me immense satisfaction and be very rewarding. But at this moment, I just don't have those long-term relationships. So it's not quite there yet. Nurses aren't afraid of blood or getting shots. I have seen so many nurses like literally curled up on counters trying to get flu shots because they're so afraid of needles. So guys, we can stab people all day long, but we also are afraid of needles a lot of the time. Guilty. Haven't crawled on a counter, but have like, I've had shots before where the person's like, are you gonna pass out? Like, I might. I just might. Blood has never been my problem, but some people aren't a fan of it. Eat a good breakfast, drink lots of water, just so you don't pass out. Wear a mask if you need to hide your face of like, horror. Nurse practitioners get more respect from other providers when they're contacted versus when nurses contact them. So I think this is like if a nurse is paging a physician versus a nurse practitioner calling, ding, ding, ding. When I've called in the capacity of a nurse practitioner, I've gotten more respect, but I usually get a lot of respect as a nurse too. So I'll say true, but really I've had a lot of respect both ways. I've never been screamed at as a nurse practitioner, I guess, but I'd say, I mean, yeah, I guess you get a little bit more respect. You have to be incredibly smart to survive nursing school. Okay, guys. Yes, you have to be like smart, but what does smart even mean? You know what I mean? So I'm gonna say false, because as long as you are, this is what you wanna do, you can do it. If you're dedicated, if you are committed to it, like I said in the beginning of the video, if you're willing to put the hard work in and do what you need to do, you can do it. Yes, testing comes easier to some people, but they might not have the people smarts that you have. Everyone has different things they bring to the table. I am not the best test taker, but I am pretty decent at talking with people and being able to do like skills labs. So I think everyone brings different things to the table. As long as you're prepared and you put the work in, you can do it. I think it gets nursing school gets talked up to be this impossible, crazy thing by so many people, and you can do it, guys. You can do it. I say this all the time. If I can do it, you can do it. You can put the work in and you're gonna get out of it what you put into it. Same with NP school, by the way. Skin cancer can be asymptomatic. Ding, ding, ding. Unfortunately, that is absolutely true. Starting around like age 35, I think the recommendation by the dermatology people to go and get your skin checked like every 3-ish years, I think. Don't quote me on that. But they go over with like a black light. It's real awkward, but they can see things that our naked eye cannot. By asymptomatic, you just might not notice, you know? So always check your moles, always check your freckles, check all of it. Have other people check all of it. Be familiar with everything. Long-term doses of prednisone will cause alterations in your taste buds. Hold on. So for things like this, who knows? I don't even know if that's true or false. So we'll go into Hippocrates, one of my favorite apps, and we'll type in prednisone and see if that shows up under the adverse reactions. It does not, so maybe it does. I hope that hasn't happened to you. That sounds terrible, but if you're up for a bad time, look at the adverse reactions of prednisone on Hippocrates, because it is a mile long and terrifies you to ever take it or prescribe it to anyone, although it does work wonders, but still. Physicians and nurse practitioners take little to no nutrition in their classes. I think this is referring to like the class nutrition. Ding, 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 which is sad. So as a nurse, I took nutrition. It was briefly talked about in NP school, kind of like, oh yeah, vitamin K, this. I think it's hugely underutilized. Obviously, I can't speak at all to med school because I've never gone to that, but I wish it had been a larger component of NP school, because I find myself doing diet teaching all the time because it's something that's easy to implement for a lot of people. It doesn't cost money, you can do it. With the flu shot each year, they guess which strain will be in it. It's not just a guess, guys. The CDC works really hard to try to figure out what to put in the flu shot. They base that based on what strains have caused people to become the sickest, how those strains that were bad spread, so like is it an easy spreadable thing, is this affecting a lot of people, and what worked really well last year, and they kind of combine all of that together and give you the flu shot. There are thousands of strains of the flu and it's constantly changing, so it can't be the perfect shot, but they do their best. Cut them some slack. Doctors are really smart and never make mistakes. But false for everyone, for all providers, for nurses, nurse practitioners, physicians, respiratory therapists. Everyone makes mistakes, guys, as long as you own up to it and we can fix it, okay? End of story there. Night shift is really hard. Ding, ding, ding. I don't know. I guess true. I have some videos on how to work with night shift and some tips for surviving it. I'll link them up here. I found it to be my preferred shift because I loved the people, and once you get in a rhythm, it really gets a lot better, but initially it is a little rough. It's not your body's natural thing. Nurses want to be doctors, but they weren't smart enough. We need both. We need nurses, we need doctors. Whatever one you pick, it's not inferior to the other one. Let's all just get along and be friends, okay? Great. Cranberry juice helps with UTIs. Ding, ding, ding. Yeah, but I would recommend more of the cranberry tablets over the juice. But as always, consult your healthcare provider. But the tablets give you less sugar, which is always good. And last, NPs don't need malpractice insurance. You do want some kind of malpractice insurance. Sometimes you can get it through your collaborating physician, like theirs can extend to yours, but having your own is probably always a good idea, especially if you're really practicing independently. Obviously you need it there. I am probably going to end up getting it. I just don't have it yet. All right, guys, that concludes all of our true and false. Hopefully you guys had fun. This was a more fun type of video after last week's, which was a little bit more serious. Thank you everybody for sending in your questions on Instagram and making it possible. If you guys are new here, welcome. I'm Liz. I make weekly nursing nursing content videos on Tuesdays and a vlog documenting my life as a family nurse practitioner on Saturdays. If that sounds interesting to you, make sure to subscribe down below. I'd love to have you on my adventure, and head over to Instagram where I post clinical tidbits throughout the week. Everybody else, as always, thank you so much for coming back. We just hit 10K and I'm like blown away. So thanks guys, you da bomb. Question of the week is just, did any of these surprise you? Let me know down in the comments. I hope you have a wonderful week and I will see you guys again next time. Bye.